Just a note about a transition that I made in my practice, which this work with Yang Sheng, which actually means, Yang Sheng means nourishing life or life cultivation. And the idea of Yang Sheng is, well, it's a worldview, it's a medical worldview, and it's a set of practices. So the medical worldview of Sheng says that there is a healing, natural, healthy life force that exists inside you at all times, and we can cultivate that. So the worldview of Yang Sheng is that we change our viewpoint, we change our view from really looking at symptomatic expression, and we pivot and look at how do we cultivate life. So my style of practice really changed at some point. For many years, maybe 10 years, maybe 12 years, I worked, I think maybe like many of you, in a clinical setting where I saw a certain number of patients. It got to be where I was seeing 4 patients an hour, and in rooms and formulas and assistants. And I loved that, and I saw a lot of volume, and I gained a lot of experience, and it was almost exclusively OB-GYN, not all fertility enhancement, but a lot of that. And at some point, after about 12 years of clinical practice, I went back to school and did a PhD in Oriental medicine. And then at that point, I was doing all of this research and integrative medicine and this very, very academic program. But what I was noticing that was happening in the treatment room was something where I was connecting with patients, where there was a kind of resonance happening between two people, and that from that resonance there was some healing that would happen, that began something else. And that was just a really interesting dichotomy. And I became more and more interested in that thing, which I didn't know what to call, and less interested in all of the academic pursuits. However, I must say that I think they nest together, that you cannot be in a clinical setting with a patient. In other words, you have to go through the whole journey of learning everything and memorizing everything and doing all of the research and all of that to get to a place where you can almost forget it and meet the patient just as a human being, but you're armed with this body of knowledge. Has anyone had that experience? Yeah. In fact, I closed my clinic, and now I work more in a retreat setting. I work with patients in a very concentrated way to help them to develop the techniques that allow them to heal themselves. And once they are armed with the tools to heal themselves, and that doesn't mean they don't need Chinese medicine or they don't need Western medicine. That means that they have skills to move them closer to balance on their own. And to create a kind of openness in their body-mind so that they have a better predisposition to whatever way they can use to get pregnant. Whether it's a natural conception, whether it's helped with Chinese medicine, or whether it's a procedural intervention. All of the ways are enhanced as the patient learns to move themselves back to balance.